hear that you're dealing with a little bit of anxiety today. Oh, I'm sorry to hear that, but you know what? It's very common to deal with anxiety and depression these days, but specifically for anxiety, I have a few techniques that might help you, okay? Anxiety is a very well documented disorder that has been around for centuries, and there's a lot of case studies about it. There's a lot of techniques that can help you live a normal life, okay? So we're going to figure that out together and figure out how to help you. Alright, great. So the first thing we're going to do is make sure that medically you're okay. Alright, so we're going to measure your heart rate, and we're also going to measure your blood pressure. And if those two look okay or normal, then we're going to figure out how to help you in other ways. Okay? Alright, let's start then. Okay, first things first, okay? I'm going to listen to your heart. Make sure that everything is in order. Yeah, that sounded very normal, especially for someone with anxiety. It's normal for the heart to beat a little faster, but that's what the heart is designed to do, you know. Some people have a heart rate that's elevated sometimes, some people have a lower heart rate. It's really not an indication of health, it's more of an indication of what's around you. So if you're having anxiety, it might go a little bit up. If you're resting or watching a movie, it might go a little bit down. So it's with everything, you know, but it's sounding pretty normal. Okay, next thing we're going to do is measure your blood pressure. So this little device over here, I'm just going to connect it to your arm. Your left arm, please. And then we just click it. And then we just wait. Alright. Cool. Alright. That looks really good. Okay, so I have some good news for you, okay? Medically, you're fine. You are safe. You're not having a heart attack or anything like that. You're completely healthy, which means that the problem is in your head. So, it's very common, like I said. But if we do a few techniques, I think we can get your anxiety disorder under control, okay? Do you worry a lot? Okay, do you have intrusive thoughts of things that might happen if you do a certain things, or if you don't do a certain things, or are you consumed with work or with finances? I mean, who isn't, right? I can imagine. I mean, we see cases like yours all the time, so don't worry. It's incredibly helpful that you're here because I have a little trick for you. So, this is what I want you to have with you at all times. This is a paper bag for sandwiches for lunch. It can be any type of bag. It can be a tortilla bag. It can be a bread bag. It can be paper, plastic. As long as it's a bag and it fits your nose and your mouth, that's really all I care about. So here's what you're gonna do, okay? Next time that you are feeling a little anxious and you have that chest pressure, I want you to know that you are safe, and I want you to know that the reason why the chest pressure is in your lungs is because your lungs oxygen is full in your lungs, so there's no space. So what you have to do is burn the oxygen that's in your lungs and just breathe the CO2, and that will burn the extra oxygen, which will make your chest feel better. So this is how we're gonna do it, okay? You're going to take a big breath in, okay? And then I want you to do that nice and slow, okay? Until you start to feel better. And if you go out on an airplane, on the freeway, if you go to a church and you feel like you're gonna have a little anxiety or panic attack, you bring your bag with you, okay? And then anytime that you feel pressure in your chest or you feel like you need to catch your breath, you do this, okay? And that's it. That's all there is. So a lot of my patients have a bag with them in their purse, in their backpacks, in their office cubicle. So it's very well documented that this helps people with anxiety, okay? And I think it can help you too. Now, I am going to recommend 2 more things, okay? I'm going to recommend you to visit a psychologist or have some sort of therapy session with a therapist of your choice that can maybe identify the patterns of when you get these attacks, and maybe you guys can think about ways to maybe minimize the impact in your life, okay? Physically, you're fine. You're completely fine. It's just that sometimes it helps to talk with a professional that knows about psychiatry, okay? So I'll leave you their number with their secretary, okay? And then you can just make an appointment with them. The second thing I'm going to recommend is, of course, yoga, meditation, mindfulness, taking a break of work if you can, or just having breaks in between your workday, eating right, exercising, things that we know already, right? Drinking lots of water, making sure that you're doing activities outside, like in the park or in the forest, wherever you live. So I would really recommend that you start being mindful of your day so that you can incorporate those activities into your daily life, okay? At least one, something that connects you with yourself and that grounds you. It can be listening to ASMR videos, I think they're called. Like, those could be great for some patients too, to relax, to unwind. And then if in 2 weeks you don't feel better, then you can come back and then we can figure out some medication for you. But I think this will work really good for you, okay? Absolutely. Yes. Okay, I know that was a lot of information, but I think it will help you, okay? Alright, awesome. Well, thank you so